My name is Wasem Alsabbagh, and I'm your cardiac rehabilitation pharmacist. I have posted this short presentation on the internet for those of you who could not attend our talk in the field house. I will talk about the medications that most people receive after being discharged from the hospital for what we call a heart event, which includes heart attack, stent, or a bypass surgery. If you have any question about this talk, please contact me at any time. It's my job to help you learn about your medications and answer any questions you might have. Rest assured, the medications you receive are very safe and effective in protecting people from having heart events or heart attacks. My goal is to help you get the best benefits from your drugs. Let's start.
Most people wonder why they have to take so many medications after they are discharged from the hospital. These are medications that are commonly given: blood thinners, cholesterol medications, blood pressure, and heart medications. If you have not been prescribed one of these, please let me know so I can check with your doctor to see if it was missed by accident. Also, if you have been prescribed these drugs but you cannot take one of them, please let me know so I can help you find a solution to the problem. First, it's important to understand what is going on your body so you can understand why you have been given all these medications. Here is a picture of an open blood vessel and also a picture of a narrowed blood vessel. Narrowing happens because of fat or cholesterol buildup. The narrowing can break apart and the clot can form on top. Now blood cannot travel through to that vessel to the heart. This is how heart attack can happen. Most cardiac patients will be given at least one blood thinner: warfarin, aspirin or ASA, or Plavix. Blood thinners make it more difficult for your body to make a clot. People who take a blood thinner every day have about 1/3 fewer heart attacks compared to people that don't take them every day. Some people take 2 or even 3 of these medications together depending on their circumstances. If you haven't received a prescription for any kind of blood thinner, or if you were not told by your doctor to buy it over the counter, please let me know so I can check to see if it was left out by accident. Not only are these drugs effective, but they are also very safe. However, the one thing to be careful about is the risk of bleeding. These medications make it harder for your body to make a clot. Therefore, please always be on the lookout for blood anywhere it's not supposed to be. For example, blood should not be in your urine or stool. Also, really large bruises might be a sign of bleeding under the skin. If you see any of these things, please let your doctor know immediately. Also, your doctor will check your blood regularly for any signs of bleeding. Make sure you go for your regular appointments and blood work to make sure your medications are working properly. Cholesterol medications. Almost all cardiac rehabilitation patients will be prescribed a medication that lowers cholesterol. If you have not been prescribed one, please let me know and I'll check into for you. This is why cholesterol medications are important. When you get your cholesterol tested, it's broken down into its different parts: total cholesterol, which is the overall amount in your blood. Some of that cholesterol is bad, which is called LDL, and also triglyceride are bad. some of the cholesterol is good, and it's called the HDL. It's important to know that we all need some cholesterol to survive, because cholesterol is the basic build-up block for many parts of our body. Now, if you do not have extra cholesterol in your body, it will have to be delivered to places of greatest need. In this case, the delivery truck is called in, which takes cholesterol to places where it is needed the most. This delivery truck is called the HDL. However, if you have a lot of extra cholesterol in your body that is not being used, your body needs to dispose of it. In this case, the body calls in the garbage truck to take it away. The garbage truck is actually LDL cholesterol. Therefore, if you have a lot of LDL or the cholesterol garbage trucks in your blood, which means you have too much cholesterol that has to be taken to the landfill. It just so happens that the landfill for extra cholesterol is in the walls of your blood vessels. In other words, those narrowings are buildups of extra cholesterol garbage trucks. Hopefully you can see how LDL is bad and HDL is good. Cholesterol drugs mainly lower the LDL or the bad cholesterol. Indeed, when cardiac rehab patients take these drugs, they can avoid almost 40% of the heart problems that would occur if they didn't take them. Interestingly, these benefits occur even if they already take the other medications like blood thinners and blood pressure medications. Most cardiac rehab patients should try to get their LDL or the bad cholesterol below 2. That seems to be the level where you are most protected against future heart problems. The blood pressure. Every time you go to your doctor's office, I'll bet someone takes your blood pressure. They actually measure the amount of pressure is placed on your blood vessels by the blood. If you have too much salt in your blood, your body won't be able to get rid of fluid, so your blood grows and puts more pressure on your blood vessels. Blood pressure makes it harder for your heart to pump all your blood around. Normally, blood pressure is less than 120/80. That means 120 is its highest and 80 at its lowest. This is an easy pressure to pump against. Sometimes during the day your blood pressure may get higher, but when you sleep it always drops down to the resting level. However, in people with high blood pressure, their blood pressure does not drop at night. This puts great stress on your heart and blood vessels. Cardiac rehab patients will often receive blood pressure medications even if they do not have high blood pressure. These medications lower the stress on your heart and help it heal after a heart attack or heart surgery. Indeed, these medications help the heart to heal, thus reduce the chance of having a future heart event by almost 25% or even 1/3 each. Most cardiac rehabilitation patients will be given at least 2 blood pressure pills.